Welcome back, and it's great to have you here on WKYT. The weather is getting colder, and that has many people feeling the effects in their joints.
Dr. Stephen Duncan with UK HealthCare is here to help us through with all this. Thank you very much for coming in today.
Thanks for having me.
So it really is true. The weather does affect how arthritis folks feel, huh?
Yeah, there's many theories as to why it happens, but as the weather gets colder, it actually makes some of your tissues get smaller, puts a little bit more pressure on the nerves. People tend to have a little bit more pain during the wintertime then.
So a lot of people have problems with hip injuries, knee injuries. What can you do to prevent that?
So a lot of it is trying to maintain a strong core. You know, it's kind of the way I look at it. If your tires are wearing out, you need better shocks, may get a few more miles. Same thing, if your muscles are stronger, may get a little bit more mileage out of those joints.
All right, so, you know, some of us walk around a little gimpy from time to time. When do you know when it's time that you really need to go in and see a doctor, get some medical advice?
So oftentimes, if the pain's been going on for more than 4 to 6 weeks, it's beneficial to start seeing somebody. If a family member or friend say, gosh, what's going on with your hip or your knee, you're limping quite a bit, it's helpful to go and get further advice or get some x-rays and see what's going on.
And if people do address issues, I think they're afraid they'll always have problems, but people can be restored to a state where they can go out and do everything again and not have those problems, right?
Right. You know, the biggest thing is life is short, so you might as well be able to enjoy it. Yeah. And so whether it's getting a simple injection in your hip or knee, or if eventually you do need a replacement, you're able to get back to those activities that you want to do and enjoy your life.
Here we're talking about, so here we are in winter, and there are some associated issues with that. Also, you'll have the ice coming up that people have to be very careful on and so forth. I mean, oftentimes it is injuries in addition to the arthritis that cause you some trouble, huh?
Correct. So, if you do fall and slip on the ice, breaking your hip sometimes is not the most ideal thing, but we still oftentimes treat it the same way. We'll replace somebody's hip if they fall, and that way we can get them back to doing their activities that they want to do.
When you do have to have a replacement, a hip or a knee or whatever, how long is that recovery?
So hip recovery is actually a little bit faster than a knee recovery. Hips, oftentimes, you're kind of back to doing your activities within 2 to 6 weeks. Knees, typically, it's if it's a partial knee, usually around 4 to 6. If it's a total knee, probably closer to 2 months.
Do you think people are sometimes surprised there are solutions for them?
Oftentimes people say, gosh, I would have done this 5, 10 years ago because I suffered for such a long time. And the biggest thing, the family members go, I told you so.
Yeah, you got it. All right.
Dr. Stephen Duncan, thank you very much for coming in.
Appreciate it.